Did you know that by the time we're 32 years old, our chances to get pregnant starts to decrease about 3% each year? However, despite these figures, the CDC states that the number of women giving birth from ages 35 to 39 increased from the year 2000 to 2012. I'm Dr. Carolina Melgar from Sono Health. I'm a practicing cardiologist focused on fetal cardiovascular health. The question I want to address today is, now that many women are becoming mothers at older ages, is it really that much more risky? In this video, I'm going to cover 10 myths and facts about pregnancy over the age of 35, so stick around. So if you're having your first child and you're over 35, you're far from alone. Just 15 years ago, the average for a woman's first birth was almost 25. And as the years go by, that average continues to rise. In 2014, the average age was about 26. What I mean is more women are having babies at older ages. So, if you're pregnant and over 35, are you automatically labeled as a high-risk pregnancy? Myth or fact? Well, mostly a myth. In reality, there isn't a strict line that makes everyone 35 and younger have a healthy pregnancy and everybody over that age have a risky one. Age 35 is more of a guideline rather than a rule. In fact, I often wonder who actually made the 35 as the cutoff anyways. Decades ago, there was a much higher risk of pregnancy complication if you waited until 35 to have a child. For example, the chances of having a child with Down syndrome at age 35 was 1 in 200. There was also a higher risk of having to go through a procedure called amniocentesis, which can cause miscarriage. At that point in time, it made sense to tell a woman that they were much higher risk at age 35 because they were. However, today, only 1 in 1,600 women have a miscarriage due to an amniocentesis. Besides, according to the National Down Syndrome Society, a 35-year-old new mom has also less risk of giving birth to a child with Down syndrome. It's now 1 in 350. Number 2, do I need to see a high-risk doctor if I'm pregnant over 35? Myth or fact? Myth. As I just said, being pregnant over 35 doesn't necessarily mean you're at high risk. That means once you receive a positive pregnancy test, it's perfectly fine to visit your family doctor or your regular OBGYN. There's no need to automatically seek out for a high-risk OBGYN unless it makes you more comfortable to do so. If your regular doctor determines that you are at higher risk, he will refer you to one. Number 3, you have a higher risk of having a baby with genetic disorder over age 35. Myth or fact? Sadly, a fact. Being pregnant at 35 doesn't automatically make you a high-risk pregnancy. However, you do have a higher chance of having a child with genetic disorders. Take a look at these figures over here. Chances of conceiving a baby with Down syndrome. At age 20, it's 1 in 2,000. At age 25, it's 1 in 1,200. At age 30, it's 1 in 900. At age 35, it's 1 in 350. At age 40, it's 1 in 100. And at age 45, it's 1 in 30. So as you can see, the older you get, the higher the risk. And Down syndrome is just one type of anomaly a child can have. Number 4, if I conceive over the age of 35, I should have testing done to see if my child has any abnormalities. Myth or fact? Fact. An ultrasound can't definitely determine whether your baby has Down syndrome, so you'll need to take additional tests. These additional chromosomal screening tests include a blood test or even more detailed ultrasound. There's also a test called cell-free DNA that screens your baby's DNA for some of the most common chromosomal disorders. This test is highly accurate and you can undergo it starting at 10 weeks. If any of the tests show that your baby may have Down syndrome or any other abnormality, your doctor will most likely refer you to a more intense testing to verify it. Number 5. Women over 35 have a higher risk of health conditions that can affect pregnancy or birth. Myth or fact? Fact. As we get older, we become more at risk for many health conditions, including pregnant women. These risks include high blood pressure, diabetes, and birth-related risks such as a higher risk of a preterm delivery, C-section, and miscarriage. However, if you're generally a healthy person who exercises, eats well, and doesn't smoke, it's much more likely that you'll experience a completely healthy pregnancy and delivery. Number 6. My health matters more than my age. Myth or fact? Fact. The risk of having complications during your pregnancy has more to do with your overall health than with your age. It's true that as the years go by, we're more likely to have pre-existing conditions that can affect our pregnancy. But if you're 35 without any major health concerns and you live a healthy lifestyle, you shouldn't be concerned so much about your age. Number 7. If you're over 35, an amniocentesis is required. Myth or fact? Myth. An amniocentesis is an invasive procedure that's done for a test of any genetic disorders. It's usually performed between 16th and the 20 weeks into your pregnancy. During the test, a long, thin needle is inserted through your abdominal wall guided by an ultrasound. The needle is passed into the amniotic sac that surrounds the fetus, and a small sample of amniotic fluid is removed and examined. The truth is, if your doctor doesn't think it's necessary, there's no reason for you to consider it. Number 8. Miscarriage is more likely the older I get. Myth or fact? Sadly, again, fact. Unfortunately, your chances of miscarriage do get higher with age. As I mentioned just now, we have a higher risk of conceiving a baby with genetic disorders over the age of 35, and sometimes they can cause miscarriage. At 35 to 45 years old, your chances of miscarriage are up to 35%. But please don't get discouraged by these numbers. This knowledge is here so we can protect you and your baby. Number 9. I have fewer chances of conceiving over the age of 35. Myth or fact? Also a fact. Generally, a 30-year-old woman has a 20% chance of conceiving during every cycle. But starting around age 31 or 32, your fertility drops about 3% every year. By the time we're 40, our chances of conceiving during every cycle are less than 5%. This happens because we have a lower quality and fewer eggs in our ovaries. By the time we're 30, 90% of our eggs are gone. Nonetheless, our chances of conceiving are more affected by our general health than by our age. Regardless of your age, you're more likely to conceive if you don't drink, if you don't smoke, if you have a healthy diet, if you exercise regularly, and have no other health problems. Remember that everything that I'm saying here doesn't necessarily mean that you can't get pregnant over the age of 35. It might take more time and more effort, but it's not impossible. Number 10. If I can't conceive over the age of 35, IVF is a good fallback option. Fact or myth? Fact, sometimes. If you're over 35 and have been trying to conceive for 6 months with no success, you may want to see a fertility doctor. This way, you'll get a proper diagnosis and a treatment. IVF may be good for you, may be a good option to increases your chance of getting pregnant. But still the success rates drop as the age of the mother increases. Other than the success rates, there are other things to consider. Some of my patients found that IVF cycles were physically and emotionally draining. I'm just saying, consider the costs associated with this treatment. Remember that there are other options. So tell me, are you over 35 and trying to conceive? Want to tell me your experience? If you have any questions, I'll be more than happy to answer them. Just leave them in the comments below. I'm Dr. Carolina Melgar from Sono Health. Thank you for watching.